Thank you for the introduction. MSK is honored to be considered in this respected group of institutions whose application of management science and operations research methodology has been truly innovative. My name is Sasha. I work within the quantitative analysis and strategic initiatives group, and I'll be presenting basically an overview of the initiatives that MSK undertakes that have been influential in cultivating this culture of analytics at our hospital. I'll briefly review some background on MSK, along with the challenges that face us and other healthcare institutions today that require the kind of insights that the field of management science and operations is uniquely capable of addressing. I'll go into how MSK's data infrastructure, along with our team's collaborative initiatives, have created a prime setting for analytics to develop in an effective way. And then I'll go into how our team thinks about analytics and methods to address questions within the institution, going into a brief overview of the types of projects that we work on, and then 3 specific examples where analytics has been influential in addressing some of our challenges. MSK is the oldest and one of the largest cancer hospitals in the world. And our mission is the prevention, treatment, and ultimate cure of cancer through education, research, and patient care. Our hospital's outstanding collaborations between scientists and physicians have built an exceptional reputation for quality outcomes. We lead in survival outcomes for many of the diseases we treat. Shown here is survival for stage 1 through 4 colon and rectal cancers, where our patients survive longer than any of our peer institutions. Part of what makes us capable of building exceptional expertise is the large volumes of patients that come through our doors. Our physicians see more cases of a rare disease in a year than some physicians do in a lifetime. We have state-of-the-art treatment facilities in an extended regional network centered around our main campus in Manhattan. We span to several locations in New Jersey, outpatient facilities in Brooklyn, and partnerships throughout Long Island and Westchester. We admit over 20,000 patients a year and have over 500,000 clinical visits annually, over 10,000 employees, and that's not to mention the support staff and volunteers. Part of our success in using analytical methods to provide insights for MSK's strategic decision-making has been the data infrastructure at our institution. With a cumulative count of over 1 million patient records on longitudinal patient care, our information systems department has worked very hard to make the data usable for research. MSK has identified the value in turning our large patient volumes into data that is accessible. We have structured data on operations, so when patients were admitted and discharged, how long their treatments lasted, what resources were used, etc. We have the financial information, the treatment cost, reimbursement. We have all the clinical information, the type of cancer, the specific procedures and therapies, what drugs were ordered and when, and we're growing our capabilities in genetic information. And of course, we have demographic data on all of our patients. All this structured data is connected in an integrated database where all the systems can be accessed by any authorized user through what we call the institutional database. We have information from the very first phone call to the follow-up care our patients receive. And that's only the structured data. MSK also has a web-based application where any researcher can do free text search on unstructured data contained in clinical notes, pathology reports, diagnostic results, among others, and we're adding those as we speak. So as we sit on top of all this data, MSK recognizes that the healthcare environment is changing. We're all familiar with this picture. Costs have been steadily rising, and there is pressure to demonstrate value. We're expecting insurance companies to play a larger and larger role. Institutions are consolidating and investing more and more in IT infrastructure to address the needs of the growing amounts of data and information. On top of it all, the population is aging, creating a new challenge to cost containment. Overall, there's a lot of uncertainty in what the future holds for our hospital and other hospitals, and competition is rising to provide best value, and we have to come up with our own ways to address it. The challenging landscape presents a unique challenge to hospital leadership. How can we provide better quality care at lower cost? For MSK, increasing demand against tighter resource constraints reinforces our institution's focus on our mission, which is better outcomes for patients. These challenges, as well as MSK's high volume of longitudinal care, provide data on thousands of patients, create an opportunity to develop a fundamental platform for using quantitative methods to gain operational, strategic, and clinical insights. Healthcare institutions historically make little use of the large quantities of data that flow through their systems, and MSK identified a unique opportunity to further our mission by using innovative analytical methods to leverage available data. That brings me to a little bit of background on how our team got started. In 2003, the Director of Strategic Planning and Innovation recognized institutional value in ORMS by taking on a part-time consultant to be the first full-time analyst in-house. In 2006, MSK established the Department of Strategic Planning and Innovation based on the idea that better patient care means finding financially sustainable, patient-centered solutions. And at its core is the Quantitative Analysis and Strategic Initiatives Group. We work closely with the design and innovation team, as well as analysts that work on performance and trends for the hospital. The following year, researchers in our institution were awarded the Franz Eidelman Award, and this went out to Dr. Marco Zader of the Medical Physics Department, who together with Director Ava Lee of Georgia Tech's Center for Operations Research in Medicine and Healthcare, put forward their breakthrough research using optimization modeling and computational techniques to create a new 3D treatment planning system that saves both lives and money. And then in 2011, strategic planning had expanded to a still growing team of analysts with backgrounds that span the range of management science and operations research subject areas and experiences. And then of course last year, we were honored with the Informs Prize. Overall, our team seeks to leverage data to provide insights in all areas of operations and strategy valuable to address the hospital's needs. Part of this is focused on facilitating analytics and analytical thought in our institution. As we like to say, one thing our hospital knows well and is good at is the science of healthcare. What we're only just starting to embrace is the science of the delivery of healthcare. A big part of the success of our initiatives is that our team lies at the intersection of hospital leadership, clinical staff, and physicians. This places the team in a unique position to integrate with staff in various departments, from surgery and nursing to pharmacy and finance, to evaluate needs and align goals with physicians, operational staff, and information systems. Moreover, this cross-hospital perspective gives us the opportunity to work beyond the department level and to think strategically about project selection, resource planning, and capital investments in close collaboration with hospital leadership. This puts us in a good position to address the challenges facing our hospital in the changing environment. Our team is introducing new ways to approach cancer care holistically and strategically by implementing ORMS methods to understand mostly nonlinear interactions involved in patient dynamics, the changing healthcare costs, and resource utilization. Basically, we look at the type of work we do in three overlapping areas: operations, strategy, and clinical analytics. Our operations work looks at all kinds of things that help our hospital run better and more effectively, looking at trends in performance and activity. We also look at how these play into our understanding of what is happening with our patients, what drives our patients being readmitted, can we predict our patients' resource needs in the future. We then seek to bring this information together. We look at our competitive landscape, how we can drive market share, which areas we're competitive in, and how we can use this information to drive strategic decision-making for the institution as a whole. Our team works on projects in all of these areas, and next I'll go through some brief examples where we have used analytics to make an impact in the institution. In the sphere of operations analysis, we look at how to allocate limited hospital resources in an environment of increasing patient demand in order to obtain optimal value from care services. Resource planning is an area where the analytics core at MSK has made major contributions. QuantStrat, our short name for our quantitative analysis team, teamed up with radiation oncology technicians and clinical leadership to analyze utilization of linear accelerators, a core piece of medical equipment used to deliver radiation therapy for cancer. Our team redefined the value units for assessing machine utilization and optimized the number of machines needed to best treat patients, effectively cutting the number of machines to 1/3 and saving over $20 million in costs. In addition to planning and allocation, MSK implements ORMS to understand changes in patient dynamics. QuantStrat worked with the design research group to plan capacity and resource needs for patients at the Brooklyn Infusion Center, a new outpatient chemotherapy site. The new center is built using an innovative, low-cost delivery model based on patient-centered service design. Working with the clinical and administrative staff at the Brooklyn Infusion Center, our team used simulation models to project changing patient volumes and resource utilization based on the particular features of the new facility. The low-cost delivery model is projected to save over $1.5 million per year. Recently, our hospital was faced with a particular operational challenge. We were seeing a growing demand for surgeries that our current facilities couldn't handle. We wanted to increase surgery volume, but we were faced with our hospital's most constrained resources, inpatient beds and operating rooms. With more surgery comes a heavier burden on our operating room facilities directly, but also indirectly on our hospital beds, which must allow capacity for post-surgical admissions. Expanding capacity of either OR rooms or inpatient beds is very costly, but at the same time, overburdening our inpatient beds may adversely impact our quality of care. In an exploratory analysis, our team realized an underutilization of resources stemming from significantly lower patient bed occupancy on Saturdays and Sundays compared to extremely high occupancy on Thursdays and Fridays. The team identified an opportunity to leverage this difference in bed utilization by strategically adding surgical cases on Saturdays. QuantStrat worked with perioperative services, physician leadership, and the Department of Surgery to build a discrete event model designed to optimally select Saturday surgical cases based on case characteristics, such as length of stay post-surgery, that minimize impact on inpatient volumes on high-volume weekdays. The main idea behind the modeling approach is that the addition of cases that are likely to be discharged before a Thursday would increase volume while minimizing strain on resources. As a result, our hospital was able to implement a surgical strategy whereby the effect on Saturday occupancy was 5 times the effect of that on Thursday, and this allowed us to increase our monthly volume of surgeries by 19% with minimal impact on other days. The effect is equivalent to over $1.5 million contribution monthly. MSK also uses analytical methods for day-to-day resource planning. One small-scale project with lasting impact was the introduction of a patient census forecasting tool used by hospital staff. The patient census is the number of patients in our beds at any given moment. It is critical for our hospital to plan well so that we do not reach overcapacity. The QuantStrat team worked closely with the nursing department to build a multivariate regression prediction model to forecast the expected maximum number of occupied patient beds each day, using information on stays resulting from scheduled surgeries and chemotherapy treatments. And the tool is used to forecast day-to-day census in order to improve staffing and resource planning decisions. Not only does MSK use analytics for operational questions, but also to aid in regular administrative decision-making on a monthly and annual basis. On an institutional level, MSK uses modeling and exponential smoothing methods to forecast admissions, surgeries, and clinical visits, among other institutional trends. These trends and predictive models are now integrated into our monthly performance metrics and annual budget planning as well. Another project area our team works in is leveraging internal and external data to assess strategic growth options and evaluate new care paradigms. Our team developed a statistically defined methodology to measure our hospital's catchment area to understand our performance in our competitive environment. For example, our group worked with hematology-oncology physicians to analyze the distribution of disease diagnoses among first-time and established patients in that department. We recognized a high rate of incorrect, externally diagnosed patients that came to us seeking a second opinion. Using the market share methodology to evaluate the reach of our services within our catchment area, we advised a marketing initiative targeting specific hematology-oncology diseases in low market share, high incidence regions, where we would be particularly effective in deriving correct disease diagnosis. Another project to advise institutional growth strategy was analysis whereby our team devised a portfolio selection methodology using binary integer programming to optimally select institutional initiatives, comparing building a new facility to investing in new IT infrastructure. We looked at the opportunity cost of initiatives that pursue a range of goals between mission and financial sustainability. The team used analysis to facilitate a process with hospital leadership and physician chiefs to weigh initiatives in terms of key criteria and institutional priorities, such as increasing patient access and leveraging strategic assets. The portfolio optimization model uses these scores as inputs, which helps shed light on competing institutional strategies. Using ORMS as a tool, MSK fosters a systemic, contextual approach to decision-making as much as possible. A particular ongoing challenge our hospital faces in making strategic decisions is how to balance the breadth of our specialty cancer care with competing resource constraints. Diseases from cancer of the bones to cancer of the eye compete for resources such as operating rooms, inpatient beds, chemo chairs, clinic space, and so on. Our team worked with the MSK leadership to create a method that identifies opportunities for selective program growth in the context of competing constraints. Quantstrat identified 3 problems with existing growth strategy methods. First, MSK traditionally takes a reactive program growth approach. Decisions are made on a case-by-case basis outside of the context of other programs. Second, growth is approached from a department perspective, such as radiology or chemotherapy, instead of a patient perspective, which accounts for the full resources needed to treat a disease. As a result, the decision to expand breast cancer chemotherapy could be made without expanding breast cancer surgery, even though breast cancer patients often need both. Lastly, the financial aspect of growth was analyzed solely based on financial contribution, revenue from reimbursement minus treatment cost, which does not account for differences in resource utilization. Analyzing the opportunity cost of disease programs, the full treatment of a disease, can allow treatment of more patients with the same amount of resources. So we collaborated with clinical staff and hospital leadership to devise a method for selecting growth of specialty cancer areas from the perspective of research opportunities, perceived outcomes, market share analytics, and lastly, resource-based optimization. Our team used linear programming to evaluate relative cost and financial contribution of disease programs in a unified framework. The model optimizes overall contribution to the hospital based on reimbursements and variable costs by weighing incremental contribution of each program against resource opportunity cost. We built a model with scenarios based on assumptions in healthcare trends and resource utilization, such as declining length of stay and aging population. We were able to evaluate disease programs on their financial value, net revenue from reimbursement and treatment cost. For example, we know we receive a higher financial contribution for leukemia patients than for breast cancer patients. But also, we were able to evaluate the opportunity cost and trade-offs in treating our patients with different types of cancer. Inpatient beds are our most constrained resource. Leukemia patients require longer stays in inpatient beds than do breast cancer patients. Our models show that the resources used for one leukemia patient could treat 13 breast cancer patients. We learned that the extremely costly nature in terms of resource opportunity to treat leukemia patients in an inpatient setting. This made the case for the building of a new outpatient chemotherapy facility whereby we could reallocate leukemia patients to lower cost, lower resource outpatient facility, thus appropriately allocating inpatient beds to other diseases such as breast cancer. The new facility is projected to generate millions over a straight line growth, and it gives us the opportunity to treat 11% more patients annually. Our group has increasingly been interested in the sphere of clinical analytics as well, particularly how we can use operational data for clinical insights. In one project, we did a comparative effectiveness analysis of several drug regimens for the treatment of non-small cell lung cancer. We derived insight that identified regimens that had high cost but low survival, and also low cost but high survival. The project was one of the first of its kind at our institution. Generally, a medical hypothesis is tested in a long, costly clinical trial process of prospective study on outcomes. We instead gained insight using retrospective data from the institutional database through a few months of thoughtful data mining and statistical analysis, much less expensive approach if accurate. This made us curious to see what the power of our data really was. We replicated a published prospective study of survival on 2 drug regimens for their own retrospective data. We were able to replicate the study's result extremely closely, which built confidence in the accuracy of our data and validity of our methods. We've been able to do other studies using our institution's cost database system to support clinical insight. For example, one project where we worked with a surgeon in gynecologic oncology to perform a statistical analysis of the cost differences between different surgery equipment. We were able to show that the robotic surgical system, which is extremely costly but has been proven to have significantly effective outcomes, actually creates a cost savings to the institution over time. Our hospital and our team is always looking at new ways to integrate analytics with clinical care. How can we translate thought leadership into applied intelligence using the technology available today and that which is developing into the technology of the future? MSK partnered with IBM's Watson team. Watson was the supercomputer that a few years ago beat Jeopardy in an amazing feat of human versus machine. Now we're seeing what Watson can do in healthcare. The idea is to synthesize treatment guidelines and medical evidence to create evidence-based, personalized care based on a patient's particular combination of characteristics. Natural language processing is being developed to understand the case, and we are working with IBM to use machine learning processes to build a tool that can learn what the best treatment is for a patient. The technology will prompt new research opportunities, new treatment approaches, and create the opportunity for outcomes analysis of these methods. Our hospital is increasingly understanding that in addition to expertise in the science of medicine, we must become experts in the delivery of medicine as well in order to address the challenges of the changing healthcare environment. We're dedicated to using analytics to inform operational, strategic, and clinical decision-making. Our perspective is that we must look at the needs of the whole patient within the whole system. Only this way can we create the best experiences and cultivate the right quality of care. We're choosing to confront the challenges of a changing and uncertain healthcare environment armed with data and insight. Thank you.